Welcome and thanks for joining us. My guest today is Rawn, Director of the Compass Rose Health Plan. Zach, thanks for being here.
Yeah, thanks for having me, Drew.
Of course. So Zach, for those who might not know, tell us a little bit more about Compass Rose and what your mission is.
Yeah, so we are a not-for-profit federal employee health benefits plan. We've been around for a while, since 1948. Really, we started in the Intel community. Over time, we've worked our way to opening up to more and more agencies. And really our mission is to keep health insurance simple for our members. So thinking of the federal workforce, how much they do for us, how much they do for our country, health insurance is the last thing that we really want them to have to worry about. So our mission is really our members and to keep it simple.
So I know that recently you opened to the Department of Veterans Affairs, and then even more recently you've expanded to all feds. So can you tell me the reason behind that decision?
Yeah, we most recently opened to the Department of VA and Homeland Security. We're still a closed plan currently in 2024, but excited to announce in 2025 that we're opening up to the full FEHB eligible population. And really, as our health plan continues to grow up, we've added more options. So we have a standard plan, a high option plan. That's what we've been doing forever, the high option. We have a Medicare Advantage plan. So we really feel that the feds deserve exceptional options for health insurance, and that's what we believe we can offer, and we believe we can offer it for every stage of life. So basically, able to serve more federal employees.
Absolutely. And can you tell me a little bit more about some of the offerings that you can get through Compass Rose, maybe what kind of sets Compass Rose apart from other carriers in FEHB?
Sure. So multifactorial. So first are the benefits. So we offer some unique benefits like massage, acupuncture, chiropractic, free telehealth. We have a robust rewards program for those in our high option. We have a very large network, so we use United Healthcare for a large nationwide network. We have OptumRx as our pharmacy benefits manager, also very large pharmacy network. So on the benefit side, we believe we have a lot of uniqueness about us. As far as member advocacy, we believe we offer the highest level customer service that can be offered. We believe that it's a driving force for me, it's a driving force for those at the health plan, but we really are focused on providing exceptional customer service. Really, if you're calling for a simple question or it's going to be a long call, you're not rushed off the phone. We're trying to help figure out how to help you, how to get the resources you need, and then just provide any education as needed.
Yeah, no, I think the one that sticks out to me so much is just the acupuncture and massage. I mean, that's one I'm reminded of every year with open season, just because that sounds really nice to have, honestly. But I'm also curious, Zach, if you were speaking to a federal employee who's, heading into open season this year and they're in the FEHB program, what would you tell them about, why to choose Compass Rose, or at least consider choosing it?
So we want to offer coverage for those who need medical care. We also want to offer coverage for people who aren't sick or don't need care at the time. So as we kind of talked about the massage benefit, chiropractic, acupuncture, and then we're always looking at unique ways like care delivery. So we offer free telehealth. We offer a digital musculoskeletal program, digital pelvic health, and then virtual everyday and urgent care. So just, that paired with our customer service and really our roots, our mission, that's what I would look for.
And is there anything else that you can share in terms of how you try to support your members in either getting healthy or trying to stay healthy?
Yeah, so one of the first things that comes to mind is our rewards program for our high option members. Really, we kind of tee up some easier items that people are probably already doing, but we want to give you credit for doing that and maybe incentivize you to look at the list of available options and maybe, add a PCP visit or do a cost calculator for one of your prescription drugs, or be part of our coaching program. So those type of things really, I believe, set us apart. And the credits that the member will receive really go towards next year's deductible. So subscribers and eligible spouses in the high option that max out the rewards points basically won't have a deductible for the next calendar year, which is pretty cool. Like I said, we really believe that we offer health insurance for every stage of life. Just thinking back to when I graduated college in pharmacy school, when I took my first job, when I was going through the differentials on signing up for healthcare coverage, I was really looking at the premium for more essential coverage for just myself being single, and then as I got married, had a child, then I started thinking, well, I need more benefits. I need something more robust. I don't want to pay. I'm okay paying a higher premium, but I want more robust benefits during the calendar year. So just thinking standard plan versus our high option plan. And then my parents are both in process of retiring right now, and they're just talking my ear off about Medicare. So we have an awesome Medicare Advantage program. It really combines our high option benefit with Medicare. And it's all kind of rolled up into one plan, being an Advantage plan. Not the ones that you typically see floating around on late night TV ads and such, but something that's it's a FEHB Medicare Advantage plan, so it's awfully advantageous.
Right, so there's just this whole range. Basically what you're saying is there's a range of options depending on where you are in life and your whole situation that Compass Rose does have available.
Yeah, exactly.
Zach, can you share any specific examples of how Compass Rose is maybe a little bit more unique than some of the other options out there?
One thing that I believe makes us unique is our nursing team. So we have nurses on staff and basically a whole team of nurses that work together to help members find care for the smallest of small things to the large, unfortunate, life-changing things. Just one story that kind of comes to me from this year is one of our members who was having kind of some non-specific symptoms, went to the hospital with her husband, and she went to the ER with her husband. She was treated and then sent home. So she was already pre-engaged with our nursing team at that point. So when she came home from the hospital, they both, or the husband really, they both collectively believed that there was probably something else more wrong than what was diagnosed or what the kind of the overall treatment was in the emergency department for her. So unfortunately, she ended up falling at home on the way in from the transportation. And she had, at that point, did not want the ambulance to come pick her up and take her back to the hospital. So her husband was able to get in touch with one of our nurses from our nursing team, and they really convinced him and her to get care immediately. So with them working with our nurses, she was able to get to the hospital, and then she was received an image, and it turned out that she had a stroke, which wasn't part of the original diagnosis or differential, but unfortunately, that was the reality of the matter. And working with really our nursing team, they were able to really make them understand that they needed to go back to the ER, get imaged. She was able to move back out of the hospital, but just thinking of a real world example that kind of hit me hard this year. So yeah, I think that's definitely one thing that sets us apart.
And just wrapping up here, what would you recommend to participants this open season? Any final word of advice for them?
Yeah, so this year is busy for everyone, including myself. Health insurance is super complicated, as we know. And really at Compass Rose, we want to make that simple. We don't want you to have to worry about coverage, network, those type of things. Just spend a little bit of time looking at comparing different plans, what you think you might need as far as care, where you are in life. Are you single, newly in the workforce, looking for a lower premium because you don't believe you'll need too much care? Or are you, a father of 3 with a wife, family? You think you will need a little bit more care. You want to lower out of pocket during the year, something more predictable. And then, looking into the different materials. So I know OPM has a great comparison website for different benefits, the premiums associated with each plan. So just my suggestion would just be look at do a little bit of research, not too much research. Don't get wrapped up in it, obviously. But really, it's about picking a couple plans and then going in and going to the member-facing materials. Kudos to our marketing team. We put a lot of effort into our specific communications, whether that be our member website or social, or if you call in, visit a benefits fair. There's virtual benefits fairs this year, several of them. We'll be there. Ask your questions.
Yeah, no, absolutely. That's really good advice. Just trying to, get as much information as possible and make sure that you make the right choice this open season. But Zach, it's been great talking to you. Thank you so much.
Yeah, thank you very much.
Zach Rawn is director of the Compass Rose Health Plan. I'm Drew Friedman, and you're watching Federal News Network. Now let me send you back to the studio for more on the open season exchange.